ABC 10 News starts now with breaking news.
That breaking news, the back and forth of opening and closing restaurants is becoming a dizzying situation for local businesses tonight. Shortly before 5, an appellate court ruled they must close once again. Only 24 hours after a local judge ruled they should be able to reopen. On Wednesday, a court ruling allowed 2 local strip clubs to remain open while their case against the county and the state moved through the legal process. He said the rule should also apply to restaurants as well. The judge confirmed that Thursday, but just before 5 p.m. tonight, an appellate court ruled restaurants cannot operate before the legal issue is settled. Supervisors Nathan Fletcher and Jim Desmond released separate statements a little more than an hour ago. Fletcher says, in part, this is the right decision to protect our communities, given the severity of cases and hospitalizations we're now experiencing here in San Diego County. Jim Desmond, who has been fighting for restaurants and businesses to stay open, said today's decision to close restaurants one day after they were allowed to open is tragic for San Diego's workforce. The seesawing of people's livelihoods 1 week before Christmas is devastating. And of course, restaurant workers across the county did return to work today, but now this new order adds more upheaval and confusion to the restaurant business. Our ABC 10 News reporter Anthony Pura is live in Little Italy with what's happening right now. Anthony, what are they telling you?
Steve, the timing of this appeals court ruling has caught many business owners off guard. I can tell you we came down here to Nolita Hall in Little Italy because they were reopening tonight. They reopened at 4 o'clock. You can see they reopened their indoor and outdoor dining areas. They are serving people right now. The staff had been so busy they did not hear about that ruling. I actually had to break the news to the manager about an hour or so into their opening night. So he said simply that they're still digesting the information, so he couldn't say what's next, but did say they plan to follow the rules. Now, I've been in contact with other restaurant owners. A few said that they had just ordered food. They had just called back the staff to begin serving people again either tonight or again this weekend, and now they're not sure what to do. They are still trying to figure out what the best course of action is going forward. We're reporting live tonight, Anthony Pura, ABC 10 News.
It has to be so hard for all of them. Anthony, thank you. So we know all of this is very confusing. So we spoke with law professor Craig Barkas from the University of San Diego about this late ruling. He explained how the stay tonight overrules the judge's decision from Wednesday, how the appeal may now play out, and ultimately what this means for restaurants in the county.
The only thing I might see going forward is perhaps the restaurant owners could try to negotiate a relaxing of the standards to this extent to allow maybe outdoor eating. I mean, maybe you can't have anybody.
We'll see what happens there. This story, as you might imagine, is rapidly developing. It's very fluid and its impact will be widespread. Of course, we will have much more tonight on ABC 10 News at 11 and on the 10 News mobile app as well. In the meantime, the FDA has approved Moderna for emergency use in the United States. This is the second vaccine approved on an emergency basis. Moderna will now begin shipping close to 6 million doses across the country, adding to the Pfizer vaccine doses already being administered to healthcare workers. California could get close to double the amount of doses it received from Pfizer last week. A recent review by the FDA confirmed the overall effectiveness between Pfizer and Moderna is nearly identical.
We got into this mess because people didn't believe that they could get sick.
And that second vaccine cannot come soon enough. Hospital beds, they are filling up fast here in Southern California. Our available capacity right now in our ICUs is at 0. Meanwhile, hospitals are also short on ventilators and staff. Our ABC 10 News reporter Jennifer De La Cruz spoke with an ICU nurse who says they are struggling to keep up with the surge.
ICU nurse Peter Sadu is overwhelmed.
We're having an influx of patients like I've never seen before.
The LA County RN says their hospitals are on the brink of their limits.
We're running out of space. We're converting any and every room into a patient room.
He feels more protected after getting the vaccine Thursday, but being short-staffed is a whole other threat.
You'll be lucky to even get a restroom break. You're on your feet, you're running. Yet patients are being intubated.
California groups counties into 5 regions as part of the new stay-at-home order. On Thursday, the Southern California region's available ICU capacity hit zero, even though availability for San Diego County is about 16%. That's because other counties contribute to our region's total, like Inyo County with only 2 beds open. Imperial County has none.
You can open up empty wings, you can convert auditoriums. I mean, you can see what some places are doing, which is parking structures and tents, but you can't replace nurses.
While there are still some ICU beds open in San Diego, they're filling up quickly. Scripps Hospitals tells us they've requested additional ventilators and respiratory therapists from the county. They added, "We've constructed temporary negative pressure rooms, added surge tents at our emergency departments, and expanded COVID care to additional hospital floors." For people who still aren't being safe, Sidhu has this message.
And now I'm looking at the kind of patients that we have. They're younger than I thought they would be. They're healthy. And they're all suffering from COVID.
Jennifer Dela Cruz, ABC 10 News.
The county says hospitals are delaying organ transplants and cancer surgeries for non-COVID patients to make more room right now. Here's the issue, too. The county just set another record in single-day cases, reporting more than 3,600 new cases today. That brings our total to more than 120,000. The county also reported 14 more deaths. Right now, over 1,200 San Diegans have lost their lives to this virus. As Pfizer's COVID-19 vaccine rolls out to healthcare workers, there have been a handful of severe allergic reactions. So a lot of people are wondering what's in the vaccine and what should people with allergies know. Our ABC 10 News anchor Derek Stahl takes an in-depth look at the ingredients.
In the last week, Pfizer has shipped millions of doses of its COVID-19 vaccine. So far, 4 healthcare workers have had severe allergic reactions after getting the shot, starting with 2 in the UK.
These were people with a history of severe allergies, and not just severe allergies like you got hives, but they had allergies where, they encountered certain things in the environment and their body shuts down.
Both of those workers carried EpiPens. At this point, doctors are not sure what caused the reactions. But broadly speaking, allergies are when your immune system overreacts to something. Pfizer's vaccine has 10 ingredients that fit into 4 categories. The active ingredient is mRNA, which are temporary genetic instructions for your cells. Then there are fats to stabilize and transport the RNA, salts to maintain the pH, and sugar to prevent the vaccine from degrading while freezing. All these ingredients are considered standard. UC San Francisco Dr. Peter Chin-Hong says he was struck by what's not in the vaccine.
So they didn't have, egg products or any of those kinds of things that people might be allergic to. They didn't have live virus, which might also elicit a response.
The only ingredient with a history of allergic reactions is polyethylene glycol, or PEG, one of the fats that acts as an oily bubble for the mRNA. PEG is also in Moderna's vaccine, and it's common. It's found in ultrasound gel, laxatives, injectable steroids, and other products. While rare, the FDA says people who are allergic to PEG or one of the other 9 ingredients should not get the vaccine. But experts say people with common allergies should not worry.
A lot of people with minor food allergies or bee sting allergies or peanut allergies or environmental allergies, and they may even carry an EpiPen because sometimes it gets severe. Those people would not be excluded from getting this vaccine.
The American College of Allergy, Asthma, and Immunology said people with those common allergies, including to latex and medications, are no more likely than the general public to have an allergic reaction to the vaccine. After every shot, people who get vaccinated have to wait 15 minutes to see if they have a reaction. The FDA says people with a history of allergic reactions to vaccines or injectable drugs can still get this shot, but they need to wait longer, for 30 minutes. Derek Stahl, ABC 10 News.
So if you are concerned about allergies to the vaccine, experts say that you should talk to your doctor first. The odds of having a severe allergic reaction to any vaccine are about 1 in 760,000. That means you really have a better chance of being struck by lightning, 1 in 500,000. You can track the latest coronavirus developments with the ABC 10 News app. You can find it for free in the App Store.